Hello, my name is Ben Shaberman. I'm Vice President of Science Communications at the Foundation Fighting Blindness. And thanks for joining me for this short webinar in which I'll be covering many of the current and emerging therapies for age-related macular degeneration. And in case you didn't know, the Foundation Fighting Blindness is the leading private funding source for research for inherited retinal diseases like retinitis pigmentosa, Stargardt disease, Usher syndrome, and the dry form of age-related macular degeneration. We've been around for more than 50 years. We've raised nearly $900 million toward our mission, and we provide a lot of great resources and information for patients that are diagnosed with these conditions, and we can help you, eye care providers, provide a path forward for these patients by helping them learn about resources, research, and clinical trials. So I want to start off this review of AMD therapies by talking about the AREDS2 formula. So AREDS2 is a supplement that reduces the risk of advanced AMD. This is for people with early stage AMD, and it reduces the risk of advanced AMD by about 25%. This came out of studies from the National Eye Institute. A few years back, NEI updated the formula, and the new formulation contains vitamin C, E, copper, lutein, zeaxanthin, and zinc. This is available over the counter, but we do ask patients to talk to you, the eye care providers, before they take it. We want to make sure the formula is right for them. So let's talk about the many wet AMD therapies that have been FDA approved. We call these anti-VEGFs. They're delivered through intravitreal injections, and they block the growth of leaky blood vessels underneath the retina. The first available were Lucentis and Avastin. These originally were delivered monthly, and a lot of doctors now deliver them more on an as-needed basis. In more recent years, there have been newer approaches. Again, these are intravitreal injections as well. Eylea, Beovu, Vabysmo are these options, and these don't need to be injected as frequently, so they reduce the treatment burden. And ultimately, it's up to you and the patient to decide what treatment is right for the patient based on the patient's condition and, of course, their insurance coverage. Now, there's a newer approach recently approved by the FDA for reducing that wet AMD treatment burden. This is called a port delivery system. It was developed by Genentech. The marketing name is Susvimo. It's a tiny capsule the size of a rice grain that's implanted underneath the surface of the eye. And it provides sustained release of a special formulation of ranibizumab, which is essentially Lucentis. And this tiny capsule only needs to be refilled every 6 months. And Genentech is actually doing studies to see if they can extend that refill time even further. And a nice thing about this approach, in addition to providing sustained release of the drug for at least 6 months before needing a refill, instead of putting a syringe into the vitreous, the syringe is put into this device. So it's a little less invasive than sticking the syringe into the eye. Instead, again, you are refilling the capsule. Now, another approach for reducing the treatment burden for wet AMD is gene therapy. This is still in clinical trials. There is not an FDA-approved gene therapy for wet AMD just yet. The idea here is to deliver copies of a gene to the retina to express the protein that can block the growth of the leaky blood vessels. So essentially, it enables the cells to produce the protein. And one injection of a gene therapy is designed to last for several years. Now, one company in this space is REGENXBIO. They have 2 clinical trials underway. In one trial, they're delivering their gene therapy through a subretinal injection. In another trial, They're evaluating a suprachoroidal injection, which is a little less invasive. And we're hoping these continue to move through clinical trials successfully. Because again, one injection of the treatment, one application would last for several years. So let's move on to therapies for dry age-related macular degeneration, specifically the late-stage form known as geographic atrophy. And in February 2023, Apellis received approval for its GA treatment known as Syfovre. This is the first FDA-approved therapy for geographic atrophy. Now, researchers for many years have observed that the complement system, part of our innate immune system, is overactive in people with AMD, and it's a big culprit in causing damage to the retina. So Syfovre specifically targets complement factor 3 in the complement cascade. By inhibiting that production of that protein, they believe they can slow, or they have shown in clinical trials, they can slow the growth of the geographic atrophy lesion where cell loss is occurring. And in their 2 phase 3 trials, they reduced the growth rate of that lesion by 17 to 22% at 24 months. This, like the wet AMD therapies, is delivered by an intravitreal injection, of course, in a doctor's office. And Apellis is recommending that doctors inject the treatment once every 25 to 60 days. Apellis also has reported that they believe about 90% of GA patients who are eligible for Syfovre will be covered by Medicare. Now, another company in the geographic atrophy space, Iveric Bio, has applied for approval from the FDA for their drug known as ACP, and they expect to get an approval decision from the FDA in August of 2023. They too are targeting the complement cascade. They're targeting a protein a little further down the cascade. It's this C5 protein. In their clinical trials, where their treatment is injected again into the vitreous on a monthly basis, their treatment reduced the growth of the GA lesion by 14% and 27% in their phase 3 trials. And this was as observed at 12 months of treatment. So we're excited. And again, Iveric Bio should have a decision from the FDA in August of 2023. Now, there are also gene therapies in development to address the dry form of AMD, again, the advanced form known as geographic atrophy. And a company called Gyroscope, which was acquired by Novartis, has a gene therapy that expresses a protein called complement factor I to, again, temper and mitigate the overactive complement system. They are in a phase 2 trial. This is delivered by a subretinal injection. And again, like other gene therapies, the expectation is that this approach will work for many years. This is in a phase 2 trial, and we look forward to further reports from Novartis and Gyroscope. Another approach a lot of companies are taking toward treating geographic atrophy is to replace lost RPE cells. Now, RPE cells are the first to go in age-related macular degeneration. And as we know, when RPE cells lost, photoreceptors and vision will follow. So there are several entities that are developing RPE cell replacement therapies. One of these that actually has a pretty cool approach is the National Eye Institute. And what's cool about their approach is the way they are deriving RPE cells. What they're doing is they're taking a small sample of blood from patients and they're genetically tweaking those blood cells so they revert back to a stem cell-like state. Then they're coaxing those stem cells forward to become RPE cells. So essentially, the patient's blood is being used to develop these RPE cells. And that should minimize, if not eliminate, the immunogenicity potential for these cells. In addition to developing the RPE cells from blood, they're putting them on a scaffold to enhance their survivability and to better orient them in the retina. They recently began putting these cells into patients in a phase 1/2 clinical trial. Again, these are GA patients, and we're hoping to hear results maybe within the next year or so, sometime in late 2023 or perhaps 2024. And there are several other companies with emerging RPE cell therapies in clinical trials for geographic atrophy, and each has their own variation on this approach. And these companies include Astellas, Lineage, Luxa, and Regenerative Patch Technologies. So that concludes my quick overview of available AMD therapies and emerging therapies for AMD. And to learn more about therapies that are emerging for inherited retinal diseases and more news from the AMD space, visit the foundation at fightingblindness.org. And if you're interested in getting connected to our professional outreach program to provide a path forward for your patients, I encourage you to contact my colleague, Michelle Glaze. She's Director of Professional Outreach, and she can be reached at mglaze@fightingblindness.org. Thank you.